Welcome to my channel. My name is Thomas A. Bushnell. I'm an attorney licensed to practice in Idaho, Washington, and California. In this video, I'm going to be talking about living wills and durable power of attorney for healthcare. Everybody should have a living will and a durable power of attorney for healthcare. You can economize and save money if we put it all into one document. What is a living will? A living will is a document that gives instructions for how you want end-of-life care. So in this situation, you're dying, you're non-responsive, and then you have some choices to make. So we have a living will. Okay, and so these choices go from no intervention whatsoever all the way up to keep me alive no matter what. So starting at this end, call it John Rambo, which is I want absolutely nothing, not even pain medication. If you don't like your wife, this is the one you might want to choose. Because if you happen to die a slow, agonizing death, you will be totally out of it and whimpering in pain, and you probably won't even be aware, but your wife will be there suffering, watching you. So unless you're like a total troll, don't choose this one. The next step up, and the most popular item on our menu tonight, even more popular than Friday Night Filet Mignon, is pain medication only. Pain medication only. Just give me pain medication. I know where I'm going. I'm at peace. Just let me go. By far and away, the number one choice. The next step up is pain medication and artificial hydration. That's an H2O there. So you got pain medication and you got an IV. The next step up is pain medication, the artificial hydration, and nutrition. That means a feeding tube. Okay? So we're progressively going up. And then up here at this end, we just do everything. I call it Dr. Evil or Jeff Bezos. It kind of looks the same. But this, send our money to the hospital and keep me alive as long as you can. So these are the choices that you will need to make and discuss with your spouse on what type of end-of-life care do you want, palliative care. Our living wills have three parts to them. The first part has to do with end-of-life care. The second part of our living will is a do not resuscitate order, or in Idaho, it's called a physician's order in scope of treatment, a post form. Most of the world calls them a do not resuscitate. If you need or want one of these, and you don't have to have one, but if you want one, you have to go to your healthcare provider to get one. I can't get you one. You can't get yourself one. They're very similar to an out-of-hospital prescription. And what they are is they're a single page, and they say, if you find me unconscious, do not perform cardiopulmonary resuscitation. The next section on it is, do you take blood products or not? And the last part is, are you an organ donor or not? So either you have one or you don't. I'm required, here at least in Idaho, to talk to you about it and ask you, do you have one or not? And if you don't have one, you would need to go to your doctor to get one. Which brings us to the third and final part of our living will, which is a durable power of attorney for healthcare. So in this case, you're incapacitated, but in the immortal words of John Cleese, not quite dead yet. If you caught the Monty Python reference, give yourself a point. So in this case, you're incapacitated, but you're not dying. You need to have someone who will make medical decisions for you. Because whenever you go to the doctor, have any procedure performed, from a hangnail to a heart surgery, somebody has to sign a waiver and release. This would be the person. And the general rule is, the more rural you are, the more lax this is. You get into the big cities, and this can be a really big deal. So you have this living will that has who's the one who's going to make decisions for you in the case you're incapacitated, but you're not necessarily dying. And who do you choose? Normally it's your spouse. And then after that, it's one of your children normally. Now, which child do you choose? Do you have that daughter who would never hurt a fly? That's not the one to choose. That's going to tear her up, because you need the person who's going to say, this was Dad's wishes, pull the plug, we're done, and be able to set his face like flint and do the job. So if you have a child who can just do the job, they don't have to be pleasant about it, just get it done, that's the one you want for this job. Now, the next thing that's very important with your living will, and that is you need to take it down to your local hospital and get it scanned in. If you don't, here's what happens, and it happens all the time. let's say dad passes away and then something happens to mom, she's in the hospital, you are her durable power of attorney for healthcare. So you get to the hospital and the doctor says, okay, who's the power of attorney for healthcare? And your brothers and sisters point to you and say, she is. Okay, well, do you have a power of attorney scanned into our records, or do you have one with you? Well, no. Well, where is it? At home, 3 states away. Or maybe it's in mom's stuff. So instead of being by mom's side, where you need to be and should be, you're back at her house, rummaging through her stuff, looking for this document. It happens all the time. Don't let it happen to you. Once you have your living will with your durable power of attorney for healthcare, get it down to the hospital, get it scanned in. Our local small hospital here in Boundary County, we mostly pack and ship people to larger places like Coeur d'Alene or Spokane. With a few clicks of a button, that document can follow you down there, and your child can meet you at the larger hospital in the bigger city. So that's a very important thing to have.